I'm Braddock Supervisor John Cook. Thank you for watching my news program, Braddock Neighborhood News, which takes an in-depth look at the local topics most important to you and our community. Even though you may not hear about it every day, domestic violence is a serious problem in our county. Unfortunately, victims of this epidemic may not know how to reach out for help or may not be aware of all the useful resources available to them. This month, I've invited Health Department representatives Jennifer Ferraro, Maternal Child Health Coordinator, and Joanna Hemmett, Assistant Director of Patient Care Services, to come on BNN and tell us about their mission of fighting domestic violence here in Fairfax County. Joanna, Jen, thank you so much for being on the show.
Thank you for having us.
Public health covers a whole lot of stuff. And we think of it in terms of everything from mosquitoes to the flu and everything else. But domestic violence is something you guys are working on a lot, and let's talk about why that is.
Well, domestic violence actually is a public health problem, and it has been something that has actually been around for a long time, but now is becoming much more of a recognized problem that really demands our attention because it's such a prevalent problem. Actually, 1 out of 4 women have experienced some form of domestic violence in their lifetime.
And when we're talking about domestic violence, I think it's easy to have a picture of somebody who is bloodied and beaten, and we know those things, those horrible things happen, but a whole lot of other things happen too. Everything from psychological issues to violence that you can't see, right? We know many times the violence is in areas of the body covered by clothing, and there's a whole lot of issues. So it's a complex medical issue.
It is, and actually the forms of violence included in domestic violence or intimate partner violence is another word that we're using more and more, actually includes emotional abuse, not only the physical abuse, but the emotional, financial control, what we call sexual coercion. There are many forms of abuse, and it also impacts not only women, it impacts men, it impacts children as well, who are witnesses to that kind of violence. And
that's a point I wanted to talk about a little bit. And Jen, you know, we think in terms of domestic violence in women, and we'll come back to the men issue because that's in there too, but children in the home, even if they're not on the receiving ends of physical violence, they can be the biggest victims.
Absolutely. Even if the child is not the victim of the abuse, they can still take what's going on in that home and take it in internally. They could have issues, you know, with having stomach aches, headaches, not doing well in school, not being able to focus because of the stress that they're feeling at home. And children, even, you know, infants, toddlers, preschoolers may not be able to express it verbally, what they're feeling, but that's how it's important for folks to recognize there are other symptoms to look for in a child that may be struggling in school or in a daycare setting because something is going on in the home.
You know, you mentioned toddlers, infants, and we have research now showing that even infants who of course can't put into words or even necessarily comprehend what's happening, but they can sense it and they can feel the tension, and they can be, their recovery can be the longest because they're so vulnerable.
Exactly, and there's an excellent video that's out there that talks about that. They look at a family of 3 children, and I believe it's a school-age child, a preschool child, and then an infant. And they followed the family for a number of years where it was a home with domestic violence, and it was the infant that had the hardest time recovering because they too could feel that stress and could not be, you know, were not able to work through that themselves. And so it's very much affects the child's emotional health and psychological health.
And that's true of women as well. Joanna, we know that you know, the first thing to heal, right, is the physical bruising, right? And But the psychological harm, the other things take a lot longer, and so that becomes a lot of what you end up dealing with.
It is, and as Jen mentioned too, the impacts can be internalized and actually affect the physical health down the road. So we have found also that domestic violence also often leads to chronic health issues such as headaches and anxiety, and could be diabetes and asthma and gastrointestinal problems down the road. Lots of things can actually have as a root cause some of that violence. But one of the most difficult to actually detect is that emotional impact, because that's not out there as evident. They've actually found that having been exposed to violence in one's history is a contributor to suicide. And so that is one of the things that that is, I mean, it's very impactful. What a thing that we should be able to try to impact earlier on to try to heal some of that emotional abuse that happens, so that we don't end up with something so tragic as a suicide.
I think we have to remember that we know that victims of assault, criminal victims who did not know their assailants, but it's a robber, or you beat up, very traumatic experiences that can have a long-lasting impact. But in domestic violence, on top of that, is the fact that your most intimate relationship is blown apart. And really that's, Jen, talk a little bit about how that, how that's sort of this additional layer that's so critical.
Sure. So when it is the intimate partner that is doing the abuse or abusing the victim, that is a relationship. At some point there is an amount of trust there, and they may rely on the abuser financially. That the victim may not be the one who's working, may be the one at home taking care of the kids. And when we look at domestic violence, it is the abuser is the one who is trying to exert power and control over the victim. So that could be through multiple methods, threatening that if you leave me, if you tell anyone, I'll take the kids away from you. If you leave me or tell anyone, you're not going to have a home to live in. There's multiple aspects where when it's someone that you thought you loved and trusted, or may still love and trust, but yet they are the one who have this control over you, it's very scary for them because they don't know where else to turn. And
especially someone who is maybe vulnerable to begin with, or who is reliant on that partner. And of course, sometimes folks find each other, not by looking, but you tend to have that drawing to. I mean, I think predators can sense out victims and get matched up. And then we see that happening. So what do? We have as many as 1 out of 4 women and some men being victims of this. We have children in our county who are experiencing great effects from this. What do we do?
Well, one of the things that we are really trying to do is to be better at detecting it, to be better at actually being able to find those victims of violence so that they can receive some help. So whether that is that they can receive some education and some awareness so that they can prevent violence from happening in their life and get out of situations that are not healthy. Healthy relationships are really what would be the goal. Or if it's that they've already suffered abuse in the past, or that they're suffering that now, we want to be able to give them those resources. So one of the things that we are trying to do here as a result actually of a broader health effort called the Partnership for a Healthier Fairfax. As an offshoot of that, there was it's called Community Health Improvement Plan, we call the CHIP, and as a result there was also a subgroup that was formed to work on domestic violence and screening specifically. So what we want to try to do, and what we are currently doing as a pilot in the health department, is to screen every woman who comes through to access maternity care services, so that it becomes just a universally consistent practice within our healthcare setting. So we are doing that now in the health department. All women are screened as they come through for a history of abuse or for current abuse and violence.
And one reason the screening is so important is that, unlike, you know, if I've got a pain or I've got a cut, I'll go to the doctor and say, yeah, I'm here because I have a cut. Most people who are the victims of domestic violence don't come in and say, hey,
Right.
I'm a domestic violence victim, can you help me?
Right.
So
Exactly.
that screening is important.
And they talk about, you know, when patients are coming in for, again, a headache or repetitive GI issues, the screening is going to help that healthcare provider have an additional tool to try and find out what could be the core problem that physically it's exhibiting itself as, you know, as a stomach ache, but there is something else that may be going on. Maybe not, but this screening tool will assist them in trying to determine if there is something going on in the home.
So we've trained our healthcare providers, right, to know, and they know that there is this prevalence of domestic violence and that it can be manifested in these other symptoms that they're most likely to see, so that they're on the outlook for it, and that's why we have the screening. But we can also call on our neighbors, our coworkers, our people in the community to have a knowledge, especially if it's a friend or neighbor, that they notice symptoms, to say, hey, is everything okay? What should people be looking for?
So again, anything that we're the I'm not going to say patient, but that their friend or their sister is having some possible injuries, a physical injury that, you know, seems unusual or repetitive. Maybe they're not wanting to go out as often. Maybe they're becoming more isolated in their home. Or maybe feeling like they can't, you know, financially, well, I can't do that right now. I can't afford that, or I'm not allowed to do that. Listening for key words that might, you know, make you think that someone is controlling their actions or making them feel like they're unable to do normal daily events in their life.
And these symptoms, Joanna, like headache, stomach, or recurrent stomach aches, these kinds of things, because since our healthcare providers are trained, if we might not want to say to a friend, you know, that sounds like domestic violence. It's something happening at home.
Right.
But if we can say, you know, you've had a lot of stomach aches lately, maybe you ought to see a doctor. And then they'll get the screening without even knowing. Because the doctor doesn't say, now I'm giving you the domestic violence screening, right? So how can that help?
Well, and actually the way it's working right now, we're doing this in the health department, but we do want to scale it up. We really do believe that if this becomes a common practice, it is a part of what is done in healthcare settings just as a routine. It's accepted. Staff are comfortable if they get the training and they have the resources, then they can become more comfortable with conducting the screenings. And then it's an expectation for clients when they come through too. Okay, well, I'm going to be asked these questions. If that is something they're repeatedly asked, say they go in every year for their annual checkup, I'm going to be asked these questions. So we're not there yet, but we would like to be there, where it does become a universal and consistent practice. So right now in the health department we're doing this, and so far it's working very well. We would like to expand it out further into the community to make that screening more routine. Emergency departments are another good example where that's a very important you know, place where people often go if they've really hit that acute stage where there has been a physical abuse that they need to go to the emergency room. But in just routine practice, it needs to be, with the prevalence being so high, as you know, a quarter of our population of women experiencing it in their lifetime, it's something that we really no longer can ignore, because it does have such an impact with chronic illness, emotional health, the witness of the children in a household who may witness that and what that may mean for their future. They may be more likely to be in a relationship in the future that's not healthy as well, and be a victim themselves in the future. So it's just very important.
And people have to realize that it's one of those things everyone says, yeah, I'm glad I'm not one of the people that would be, you know, affected by this. It's always somebody else, but it's not. We know statistically across racial groups, across socioeconomic groups, income levels, it's everywhere.
Yes.
And so it is a mistake to think, well, that's some other group's issue, problem. It could be, you know, your family, your neighbor, your coworker. We see it all through in the health department.
Absolutely, and we say that you know, domestic violence does not have any prejudices. It can happen anywhere, in any home, in any environment, and you know, it is something that people need to have more awareness of. That it is not going to be only, you know, in possibly, you know, a lower socioeconomic home. It can be anywhere. And
another thing that we try to do is reaching out to victims to reduce that sense of shame, right? They're so unwilling to come in, to acknowledge what's going on. They don't want to tell anybody. Joanna, how do we deal with that?
Well, I think one of the ways is what I mentioned earlier, is making this a universal practice to screen. So it becomes more normalized that these are questions that everyone is asked. So if everyone is asked these questions, then maybe it's a little more common, and it's not just me. I'm not the only one. And so then every time, if it's a part of the universal screening, the resources are provided, a little information, a little education is provided, so that hopefully, you know, if their victim isn't ready at that time, but perhaps at the next time, or that they have those resources then in hand or in their mind, so they know at a future time, perhaps when they're ready to seek the resources and the services that they need, then they will have that. So I think that kind of normalizing it in that way, that it's not a normal thing to have intimate partner violence happen, but to normalize it in the sense that it should be asked. It's not something to shove under the table in the closet. It's something that we need to bring out there and say, this is a problem, we need to address it. We can't address it until we discover that it's there, so we need to be asking these questions.
And let's follow up on that. So someone comes in, they're having their health screening, and they get the screening questions asked, and doctor, the nurse taking the information, you know, you've got a certain, the answers are pointing toward a possible domestic violence incident. Now what happens?
Well, one of the things that we're now doing in the health department is, if we've got that victim in front of us and the nurse is there in the room, it's a confidential setting, rather than just simply giving them the information in hand and they walk out the door, we do what we call a warm handoff. And that call is made at that time to a resource, to whether it's an acute need and they need to have a physical exam at that moment. Then there is a number that we call and a resource that we call. If it's that they need shelter, then they need to find you know, a victim placement into a shelter, then that call can be made there while the victim's in the room. Or if they need the resources and some advocacy, an advocate to connect with, then that person can be called. So that's one of the ways that we're helping. And we have found that when our staff actually have the tools they need, they've got the education, they have the resources that they're helpful for the victim that is there, they're more comfortable asking these questions and actually addressing these issues.
And I think that's an important point, because a lot of times studies have shown that healthcare providers may feel uncomfortable asking the questions. They may feel that it's not their business. The client's there for a physical ailment. They're going to take care of that. But for them to be able to take that time, that extra time to do the screening and ask the questions, they have found that that is much more helpful. And other studies have shown that victims have said they want their healthcare provider to ask them, because it's one of the few times they are alone with someone where they can disclose. And very often healthcare environments are a trusted environment for clients or for patients, and they want their healthcare provider to ask. And we want those healthcare providers to feel comfortable asking.
And how are we doing there with our providers? Are they welcoming the screening, the antibody tests? Are they becoming comfortable in helping their patients work through this? what are we seeing with our nurses, especially, I guess, and our doctors?
Yes, they were very grateful for the training. We just started the training this past summer. So all of our nurses within the health department that are seeing these patients were thankful that we were providing the education and how to ask the questions. We would go through all the different questions that are on the screening tool, and if they were unsure about if the client had questions, well, what do you mean by that? Give them some tips on how else you can ask that question. We did role play. So they feel much more comfortable being able to answer these questions, and that's why we want to keep reaching out to more providers within the community with this training to help them be asking the same questions as our health department staff are doing already.
And do we incorporate this into our work we do with expectant mothers? We're of course doing a lot of physical exams and that kind of thing, but that's would seem like to be a great intersection of when to be really ramping up the look at this.
Yeah, and that's exactly what we are doing in the health department now. This is done at the initial visit to access the prenatal care. We are doing it, but it is found that actually violence during pregnancy increases. There is a greater prevalence of violence during a pregnancy, so the screening needs to be done again at another point during the pregnancy. And so we are now working with other providers, or we're initiating that now, to work across the community and to see if we can get the other prenatal care settings involved with the screening to expand it. The violence during pregnancy has a very devastating impact on a pregnancy. It actually can double the rate of premature delivery. It can really affect the outcome of that infant. So we want to make sure we have a healthy infant born to that mother, and so it's really very important.
And Jen, you mentioned reaching out to providers in the community, and how are we doing there? I mean, our health department's taking a lead here, but we know that private providers are doing the bulk of the medical care, and how are we doing in getting them on board?
It's coming along. We do have, as we have been reaching out, like I said, we are sharing information with our partners who help us with our OB care. And then those same partners then are reaching out to their own private partners that they may be working with. And we're also going to be having about a 2-hour program also that we're going to be presenting to physicians in the community. And then we're looking also in a few months in the springtime to be able to offer a summit available for everyone within the community to let them know what we've done so far, where we are, and where we hope to keep pushing the information out to more and more providers.
What's the feedback? How are we doing? Are private providers open to this? Is it a difficulty since they're paid providers? Often they're on schedules. We all know you go to the doctor and you hope you can get a sentence in before they leave. How are we doing?
It's true. Well, one of the things, we're still working on it, but one of the helpful things actually is that this, as a part of the Affordable Care Act and all insurance insurance companies, actually this is a free service. It is something that they are able to, or for patients this is a free service. So it is something that is actually a reimbursable service through insurance and through Medicaid. And so that's certainly a way that we can help incorporate it, because yes, I mean, to be honest, those visits to when you go to the doctor, they are quick. They allot a certain amount of time. They're very busy. They've got a lot of things to do on a visit, and then a lot of others to flow through that clinic. So as much as we can, we are working with them, but it's still in the early stages. I think if we get more awareness out there through different events in the community and work with some key stakeholders in the private provider community, then those are in the plans, and we will be making some more inroads.
That's great. So we've got maybe a minute left. Jen, what else are we looking at in the community? What should people be aware of in this issue?
Well, we're going to, like I said, we're going to keep pushing it out further along to the private providers. We are going to be having more summits to invite larger groups, as Joanna said, with our key stakeholders in order to try to get the word out for more people. We have websites. Our Office for Women and Domestic Violence and Sexual Assault Services through the county has lots of information, and our Domestic Violence Action Center has lots of information for our community members to go to and have it readily available.
So if people maybe are a victim themselves and they're afraid to talk to someone, go to the website, read up on it. If you have a family member, friend, neighbor who you think maybe something's going on and you want to read up on it, please do. There's a lot of information out there, and we could talk a lot longer, but we're out of time. I want to thank Jennifer and Joanna for joining me today and for the work they do in making our county a much safer place. I hope you have enjoyed this segment of Braddock Neighborhood News. Thank you for watching. If you have any questions, comments, or other needs, please contact my office at 703-425-9300 or email braddock@fairfaxcounty.gov. Tune in next month for another edition, and please remember to volunteer your time. Our community needs you.